Excellent point. Our next discussant is Robin Phillips. She has served in a variety of capacities in the transportation and community transportation industries, and for the last 16 months, she has been the executive director of the National Rural Technical Assistance Program. Robin Phillips.
Yay, I'm really happy to be here today and to be talking about this. And as Rich has said, this is a discussion that's been going on for a long time, and many of you have been in it for a long time. I really have appreciated the things I've been listening to this morning. It's made me think about a lot of the questions and ideas that I've had for years. And the National Rural Transit Technical Assistance Program reaches out to rural operators. It's the people are 88% of them doing general public demand response. They're also doing, or not necessarily general public, but they're using the demand response model. 25% fixed route, 32% deviated fixed. And this is from a survey we do every 2 years where we talk to both the transit operators and the FTA program managers at the state level. So we have really our program is, like we were talking about earlier, a hub where information comes from the transit operators to us, asking us for trainings that are specific to the needs that they're experiencing in their programs, whether it's succession mop-up, i.e. they've had some new person come in that knows nothing, and they looked around and there wasn't anything there to tell them what they needed to do, or anybody around them except maybe at the DOT, maybe not at the DOT, depending on which DOT you're talking about. There's a lot of young, new people out there that can bring a lot of energy into these programs. But one of the things we need is a way to do knowledge management. And I see my program as one where that's our focus, is trying to help people hit the ground running so that when you guys come to talk to them, they know what you're talking about. I spent the 2.5 years prior to this commitment living out in Eastern Oregon, which is about 33,000 square miles. It fits several New Hampshires and Vermonts, and working with Rich and other people around here and listening in to help these rural programs spread that peanut butter really thin and maximize it. And in Oregon, we had earlier, Heidi was talking about the Oregon program, and what I see as one of the major issues for rural providers is match. And if you're a healthcare person, you're like, well, I understand match. You have 50% match the state pays. Well, boy, transportation providers would just sing hallelujah if every time they said, yeah, the federal government gave us more money, and we're going to give you the state match. No. So I think that when we're looking at these solutions, sometimes the healthcare organization doesn't understand the way that financing happens. And so for these rural providers, that little bit of money that you can pull as part of your benefit sometimes can leverage larger dollars and help us find that intersection between the individual and the system. And I think that's the other piece where this whole discussion really is the rubber hits the road. Because if you're accountable for an individual, then you're having one ride, one ride, one ride, one ride. And if you're a person who's trying to do transportation, that maximizes your expense. And if you're talking about rural medical appointments and you're going to Portland from where I was stationed, 280 miles, that's one ride, one ride, one ride at a lot of money. And it's the same cost fundamentally if you have one bus with 5 riders, but you do that trip at different times and all of a sudden that cost escalates beyond. So one of the things that I see is the need for our communication, and I think that is also a code word for partnerships and relationships, but we need to be sharing quality information, not just we want to work together, but we have the doctor tell the patient, you need to come in again. We have the patient tell the transportation operator, I need to go in again. And then the operator is just like, well, I don't serve during that time. I don't run during that time. I don't go to that area. So if you're talking about Medicaid transportation, then you can go to some brokerage model or you can do some other payment. But if you're talking about people who are in Medicare, That's not going to work, and they may be making only $5 a year more than someone on, Medicaid. So you have to think about the environment you're trying to serve, and so I see the opportunity in developing that communication connection between the provider of healthcare services and the provider of transportation services, because at that point, and this is where technology comes in. You've got appointment setting. You all know how hard it is to set up a meeting with busy people. I mean, we have Doodle because people can't set up meetings. And I don't know, I haven't had a personal assistant for almost 20 years. When I started, I had a secretary, but I also had an office. My salary has gone up, but my kind of hardwired amenities has sort of gone to a more adaptable and, let's say, innovative location. So I think that the technology can help us with that question, especially if we can intervene at that healthcare operator level where you're asking your customers, when are you available? Oh, and then you can connect with it. If you've got good communication with that healthcare provider, you can know, oh, this is when we can provide service. And another, I think, structure that I've run into as a healthcare consumer is that if you are a patient in a healthcare concern, you're scheduled on a certain tier. Returning patients. But if you're a new patient, you're on a different time scale. And if you're having a callback appointment, you're getting a different time scale. Well, you know what? If you know when that transportation is running, maybe the people who are transit dependent should be having dialysis Monday, Wednesday, Friday. Those people who have other options, have mobility, Tuesday, Thursday, Saturday, because you're not going to get a lot of rural systems that are running on Saturday to help a dialysis patient. And there's nothing wrong with that. Let's do it. I think that's really a lot of the common sense things that I think our conversations can help us do. And if we can work together to look at the investments that we're all making to make our communities strong and stable and vital, I think we can find ways to leverage each other's dollars. So with that, I'll give it back to Rich.
Robin, is it only transportation providers who can access the resources of the national program?
We're available to anybody. We have downloadable resources for driver training, for administrative, for financial management. All of our downloadable resources are available to everyone, large or small. And we appreciate and like that. Our downloads have gone from about equal maybe 5 years ago to like 10 times. So we have published materials too that are for the 5311 rural operators. But those published materials used to be the only thing. Now we've got online, we've got learning management. We went from like 1,400 to 25,000 for our download. So we really are there, and really your responses when you go on the site. Thank you, Rich, for mentioning nationalarcap.org, national NARCAP.org. It's all available to you to look at, and if you see something that is, or you don't see something that you think really should be there, let us know, because that gives us really good feedback on what we should be doing next. And questions to put to our user group, or if you have a question about healthcare and transportation, we can put that out on our e-news. We can put it through a survey if you have something like that. If you have, you want to talk to state DOTs, we send out emails to the state DOT, the training managers. So this is an area where we're happy to serve as a collaborative hub as much as we in this group or nationally need that.
Thank you, Robin.
Do you certify through your online courses?
The one certification class that we have right now is an alcohol and drug certification that meets the FTA requirements, and that's going live like now. It's soft launch and available, and it's an hour drug thing, and it has a prequel. Rich, I think, was probably instrumental in helping